Hi, I am a family physician at Rockwood Multicare Quail Run Family Medicine on the South Hill in Spokane.
Wonderful. All right.
Yes.
So I am looking at our numbers. CDC right now has got Idaho in the very high category, and it looks like we're sitting in orange here. So we're in the high category in Washington. And that says to me we got a lot of people that have got some serious sniffles going on, and maybe a little bit worse than that. So from your standpoint, how busy are you right now fielding these kind of calls?
We're very busy. I work in a family medicine clinic, so I would say we field a lot of those calls. A lot of the sicker patients are ending up in urgent cares or other sites, but in primary care, we are sort of the front lines for physically seeing patients in virtual capacity, having patients call our office, talk to a triage nurse, send messages. So we're getting lots and lots of questions and hearing about a lot of illness in the community.
What would be one of the more common questions that you're being asked?
Um, I think a lot of people tend to, stay home when they're sick, rightfully so. But, a lot of questions about when should I be going into an urgent care? When should I be getting on a medication? When should I be seeking a higher level of care, such as the emergency room?
And that's a great point of a starting point for us on this conversation because it's not just about the type of care that you're getting, but the cost that you're going to be charged as a patient, or your insurance may end up having to take if you go to the wrong place at the wrong time. So, how do you answer that question? When should I be contacting my primary physician versus going to an urgent care?
Very good question. There's not a perfect answer, but know that, um, by having a primary care physician, you definitely have resources. So all of our clinical sites, and I can say the same as for other healthcare organizations in the community, we have triage nurses. We have the ability to do virtual visits. We have the ability to do inpatient or in-person visits, and then urgent cares and obviously emergency rooms. So one of your first lines would be to pick up the phone and call your primary care physician's office, where you'll likely be directed to speak to a triage nurse. So we have excellent triage nurses who can really help direct what the right place for you to seek care may be. And that may be, just staying home. It may be doing a virtual visit or going to your doctor's office or an urgent care setting. So
So,
there's options, lots of options.
so if I'm not sure if I've got the flu or COVID, what are some things that I can do at home to make sure that I have some data to give you on a telehealth visit before I make that visit to your office?
Yeah, really good question. I think, one thing that's changed in the last 5 years is we now have really good access to rapid home testing for both influenza and COVID. So having some of those tests on hand before you're sick can be really helpful, to be able to do a home test and to let your medical provider know if you're positive or negative, and that can definitely help us to know if a person needs more care or should just stay home and do the usual symptomatic treatments at home, like Tylenol, cough syrup, that kind of thing.
What are some signs that I might be overly dehydrated and I need to come in for fluids?
Can you get your
The Outlook is
yeah.
not working.
Sorry, can you oh, I think
What do you
I
want
just
me to do?
there we go. I'm sorry, can you say that one more time?
Yeah, so depending on how sick I am, like let's say
Yeah.
it's a neurovirus or whatever it is, and so I'm drinking and everything like that, but I just can't hold on to fluids. What are some things that should be a warning sign to me that okay, staying home, drinking is not doing it. I really need to go in and get some professional help with some fluids in my body.
Yeah, really good question. So, obviously, with any illness, whether it's a GI bug or a respiratory bug, hydration is really important. Drinking fluids, adding some electrolytes to your fluids, things like Pedialyte, Liquid IV can be helpful. But your gut, your stomach and your GI tract has limited capacity to absorb fluids. So, if you're adequately absorbing and you're not vomiting, you're keeping fluids down, you're urinating normally. Those are all good signs. But if you can't keep fluids down, if you're vomiting, if you are becoming lightheaded, dizzy, having any kinds of signs of confusion, those would definitely be reasons to seek a higher level of care.
Now, would that be an urgent care visit or would that be an ER visit?
So, good question. I would say in those situations, I would probably call your doctor's office, talk to a triage nurse, and depending on the level of severity of symptoms, they may direct you either to an urgent care setting or in more serious situations to an emergency room. But you can always call and speak to a triage nurse who can kind of help to assess which is the best level of care.
Let's talk about temperatures for a second. So when we are taking our temperature at home, we've got different ways of doing that. We've got the tongue thermometer. We've got the old one with the mercury, which I'm sure a lot of people aren't using anymore. We've got our digital thermometers. We've got the ear ones. So depending on the type of thermometer I have in my house, how much trust should I put in that it's giving me an accurate indication of what my level of fever might be?
I think all of those methods have pros and cons. And so when you're really sick, obviously you're going to use what you have at home. You're not going to be running out to buy a new thermometer. So having that in advance is helpful. And they're all reasonably accurate, and again, something you can discuss with a triage nurse. And temperature in and of itself isn't a reason to go to the emergency room or to an urgent care, but it's just one piece of the puzzle that we can use to help put symptoms together and decide severity of illness. And it's going to be different for different people. If a newborn baby, for instance, has a high fever, that's a different scenario than if a healthy 30-year-old person has a high fever versus, an elderly person with chronic medical conditions. So, I think have a thermometer in your house and, have that in advance, have some flu and COVID tests in advance so you can be prepared should you get sick.
I did recently just have an employee that had to stay home and then ended up having to go to the emergency room. Had spoken with their pediatrician on this. The temperature of the child, a 4-year-old, got to 103.9. So at some point, you're like, I can manage this. I don't want to bother anybody, but at what point would you say it's better to go ahead and call and let us tell you you're okay, as
Yeah.
opposed to just assuming that you're going to be fine?
Yeah, I think in a healthy, otherwise healthy person, assuming there's not, other chronic issues going on behind the scenes, it's, you can have a high fever and still be relatively okay. And that can be very common with viruses like influenza. But having some Tylenol, some Advil on hand at home, things like that to help bring down fever can be really helpful. And please don't ever hesitate to reach out to your primary care physician's office to discuss how you or your child is doing. That's what we're here for. We have excellent triage nurses and teams that can really discuss how things are going. And it's an individual situation. Some people stay home with a high fever and do really well and never need to come in, and they're very healthy to begin with. And then there's other people where we can become very concerned quickly. So please always reach out and don't ever feel like you have to just be home and tough it out without any medical advice.
If I were to do some bullet points at the end of this story, just so that I can help people understand, this is a primary care, this is an urgent care, this is an ER visit. What would you say fall into each of those categories?
Yeah, so primary care, are you talking about like if you're say have a respiratory
Yeah.
illness? So yeah, so one thing that I have seen change in my 20 plus year career in medicine is that we do have a lot more levels of care and options for the consumer than we did even 5 or 10 years ago. So, primary care visit could be, somebody who's mildly ill, had a cough or, has a sinus infection, thinks they might have strep throat, someone that doesn't need to be seen immediately, but maybe could wait a day or two, or we're happy to see them. But, coming into an office when you're sick isn't always fun. And you don't necessarily want to expose other people. So we have options for mildly sick people who are home and generally doing well to do things like electronic consults through their patient portal, which is in our health system called MyChart. We have options for virtual visits. So those would be visits with a physician or advanced practice provider virtually, where you may not need to leave your house, but you just want some advice on how do I manage symptoms of the flu, or do I need a medication like Tamiflu? So virtual visits we can definitely arrange through your primary care's office, and that makes it more comfortable for you to be at home and also not exposing other people. But then, if we take a little step higher and we are thinking about urgent care visits, those are often really convenient, easy to get into, quick, but they can do testing for things like flu, COVID, strep, bladder infections. Sometimes urgent cares can do IV fluid hydration. And the big advantage is they're open much longer hours than we are. So, after hours, weekends, times that aren't as convenient to get into your primary care office. We have urgent cares in Multicare called Indigo. So those are a great option. And then really the highest level of care would be the emergency room. So emergency rooms are great for emergencies, and there's lots of reasons people absolutely have to be in the emergency room. But if you have chest pain, shortness of breath, you can't breathe, symptoms of stroke, neurologic symptoms, trauma, severe pain, car accidents, are all really very much appropriate reasons to be in the emergency room. However, if you say have had, influenza symptoms for a couple of days and you're not having trouble breathing and you're just uncomfortable, it can be not so fun to have to sit and wait in the emergency room for a very long time to be seen for something that you could have seen your primary care, done a virtual visit, or gone to an urgent care for. So those are kind of the various levels of care and sort of what they're designed for, but it's not always easy to know exactly where you should land, especially when you're not feeling well. So we're happy to help talk you through that.
That's all my questions, Dr. Anderson. Is there anything that I didn't ask that you need to highlight for us on this?
I would say, use your healthcare resources. Thankfully, we, as health systems, in a city the size of Spokane, we have good resources, and definitely more resources than we did 5 or 10 years ago, especially for online virtual type care. As health care providers, it's a stressful time for us to see so many people being sick, and sometimes we're wearing masks and trying not to expose people to illness. And so thanks for bearing with us on that. Vaccines are important: flu, COVID, RSV, Tdap. Those things are all important at preventing illness. And thanks for just reaching out to your healthcare provider if you have questions, and trying to stay healthy and not expose other people to illnesses. And come springtime, we're all going to be outside and hopefully not having to talk about influenza.
That's the hope.
Yeah.
That did raise one additional question. So one of the things that we keep hearing about is this new strain of influenza that's going around is not in part of the current flu vaccine. So if I've not gotten my flu vaccine and I come to you and I say, well, it's not going to protect me anyway, so why should I even bother? What would you say to that person?
So every year, I've been doing this for a long time, and we've had flu vaccines as long as I've been practicing. And every year, there's various levels of effectiveness, shall we say, of the vaccine against a certain strain of the influenza virus. And, I get my flu shot every year. Some years it's more effective than others. You're still going to have some degree of protection. And, theoretically, if you do get influenza, you would have a milder course if you're vaccinated. So I still believe that it's a very good thing to do. And every year we kind of see how well the scientists did at predicting the next wave of influenza. So,
And Phil, just to jump in here real quick. So, something that I found interesting that I learned from one of our other doctors, and I'm sure you know this too, Dr. Anderson, is that the way that the vaccine is developed in the northern hemisphere is based on trends that we are seeing in the southern hemisphere.
Yeah.
So, yes, there are going to be some that we're not expecting, but I like to think about the ones that we did expect and we are staying protected from them. You don't hear about them because people aren't getting infected with them, because that's part of how that vaccine is made based on what we're seeing in the southern hemisphere for us in the northern hemisphere. Does that make sense?
Yep. And I've heard the exact same thing. So
yeah, and
nice to
I
hear it
and I
twice.
I think along those lines too, what we're seeing locally isn't always what's happening nationally or internationally. And, a lot of people, a lot of my patients are traveling around the world. And, so whatever we can do to protect as much as we can from illnesses that are preventable is important. So,
Dr. Anderson, thank you very much for your time. And,
yeah.
you know, we, well, I don't know if you feel super comfortable about this, but there's a lot of good information here that's going to go beyond what I'm going to put on a linear newscast. So I'd like to take this conversation and just put it up on our website so people can listen to the full conversation. So is there
Okay.
anything that you said that you wouldn't want in that?
I don't think so, Kevin.
I don't think. I guess one other question that I do wonder is, we talked about this a little bit, but for loved ones, because a lot of
Yes.
people want to kind of just tough it out, as Phil mentioned.
Yeah.
Um, is there like a tipping point that, okay, you've had this cough, you've had this cold for 2 weeks. When do you need to
Yeah.
really go in? Okay, you need to do something. Is there kind of a tipping point that way?
Yeah, I think any kind of illness that goes beyond, 7 to 10 days, it's worth reaching out to your healthcare provider. Everyone's different, but, very young children, and then older people or adults with chronic medical conditions might want to reach out a little bit sooner, depending on their health status. And then any of those very severe things like chest pain, shortness of breath, passing out, um, not able to keep fluids down, those would be reasons that you want to seek care and not wait 2 days to see your doctor. You might want to be thinking about an urgent care or the emergency room for more severe symptoms. So, I think my message would be don't ever feel bad about seeking care, and definitely don't ever feel bad about picking up the phone or sending a message to your physician or advanced practice provider or your care team, or talking to a triage nurse. That's why we're here. Hopefully, we can help direct people in the right direction. And don't ever just try to tough it out in silence if you feel like something is not following the usual course of a respiratory illness.